Cracking the Code, a comprehensive guide to diagnosing Paget's disease of bone. Introduction. Welcome, everyone. Today we're going to talk about a disease that affects millions of people worldwide, Paget's disease of bone. While it may not be as well known as other conditions, it's important to understand its diagnosis and treatment options. Paget's disease of bone is a chronic condition that causes bones to grow abnormally. This can lead to pain, fractures, and other complications. It's estimated that up to 3% of people over the age of 40 have Paget's disease of bone, making it more common than many people realize. What is Paget's disease of bone? Paget's disease of bone is a chronic bone disorder that affects the normal process of bone growth and remodeling. It is characterized by abnormal bone tissue formation, which results in weakened and enlarged bones that are prone to fractures. The symptoms of Paget's disease of bone vary depending on the severity and location of the affected bones. Common symptoms include bone pain, joint stiffness, deformities, and hearing loss. In severe cases, Paget's disease of bone can also lead to nerve compression and spinal cord damage. Causes of Paget's disease of bone. Paget's disease of bone is a complex condition with multiple contributing factors. While the exact cause of the disease is not yet fully understood, research has identified several genetic and environmental factors that may play a role in its development. One major genetic factor associated with Paget's disease of bone is a mutation in the SQSTM1 gene. This gene provides instructions for making a protein that helps break down and recycle old bone tissue. When this gene is mutated, it can lead to abnormal bone growth and remodeling, which are hallmarks of Paget's disease of bone. Environmental factors such as viral infections have also been linked to the development of the disease. For example, exposure to the measles virus early in life has been shown to increase the risk of developing Paget's disease of bone later in life. Diagnosing Paget's disease of bone. The diagnosis of Paget's disease of bone is typically made through a combination of imaging tests and blood tests. X-rays are often the first imaging test used to detect the disease, as they can show characteristic changes in bone structure. However, more advanced imaging tests such as bone scans or MRI may be necessary to confirm the diagnosis or to identify the extent of the disease. Blood tests can also be helpful in diagnosing Paget's disease of bone, as they can detect elevated levels of alkaline phosphatase, an enzyme that is often elevated in people with the condition. If you are undergoing diagnostic testing for Paget's disease of bone, it is important to follow your doctor's instructions carefully. You may be asked to avoid certain medications or supplements prior to the tests, and you may need to fast or limit your food intake before a blood test. It is also important to let your doctor know about any other medical conditions you have or medications you are taking, as these can affect the accuracy of the test results. Treatment options for Paget's disease of bone. There are several treatment options available for Paget's disease of bone, including medication and surgery. The choice of treatment depends on the severity of the disease and the symptoms experienced by the patient. Medication is often the first line of treatment for Paget's disease of bone. Bisphosphonates are a common class of drugs used to slow down the bone remodeling process and reduce the risk of fractures. Other medications such as calcitonin and teriparatide may also be used in certain cases. Surgery may be necessary if the disease has caused severe deformities or if there is a high risk of fracture. Surgery can help correct bone deformities, relieve pain, and reduce the risk of fractures. However, surgery is usually considered a last resort and is only recommended when other treatment options have failed. It's important to discuss the benefits and risks of each treatment option with your doctor to determine which option is best for you. Conclusion. In conclusion, Paget's disease of bone is a complex condition that can have serious consequences if left untreated. It is important to understand the symptoms and causes of the disease, as well as the diagnostic and treatment options available. Early diagnosis and treatment are crucial for managing the disease and preventing complications such as bone fractures and deformities.